However, there is another proposed vaccine trial that is anything but standard. The test intentionally infects volunteers with the coronavirus. But as Drew Griffin reports tonight, people are still signing up by the thousands.
He donated a kidney last summer. Now, A.B. Rohrig is ready to medically volunteer again, this time as a human guinea pig in a vaccine trial designed to infect volunteers with the virus the world has never known.
Just like the nurses and the doctors on the front line, I'm willing to take some risks myself if it means that we can move through this as a nation and as a world.
He's 20 years old, lives in New York, has seen what the pandemic can do, and has signed up online to be a volunteer in a potential COVID-19 human challenge vaccine trial. Unlike other vaccine trials, in a challenge trial, a group of volunteers would first be injected with a potential vaccine, and a second control group would be injected with a placebo. After allowing sufficient time for the volunteers who got the vaccine to hopefully build up immunities, it's all challenged. All the volunteers, those with and those without the vaccine candidate, are intentionally contaminated with coronavirus. Risky, potentially even deadly. Yes, all of that. But it also might be a quicker path to an actual vaccine for the rest of us. Mark Lipsitch, Harvard epidemiologist, is one of the scientists whose idea of using a challenge vaccine for COVID-19 is now gaining interest from the World Health Organization.
This could save months of the time required to evaluate a vaccine. The goal is to do the fastest, responsible, and scientifically valid way of evaluating the vaccine.
Multiple vaccines could be tried at the same time, controls put in place for proper medical care for all the volunteers. And by selecting only young, healthy adults, Lipsitch says the chances of someone dying is extremely low.
But it is not zero.
It's not just the risk, it is the unknown risk, says Professor Robert Reed at the University of Southampton in the UK. He's in favor of the idea, but insists there would need to be full disclosure.
This case is different. We're not able to quantify the risk to the volunteer. And when we take informed consent from them, we will have to say to them that we cannot say exactly what is going to happen to them.
Despite the risk, 16,000 people from more than 100 countries have already signed an online form saying they're interested in becoming volunteers. That includes U.S. Army veteran, businessman, husband, and father of 4, John Gentle of Alabama.
Yes, I am putting more people directly related to me at a greater risk if something were to go wrong, but I feel like the risk is low.
So far, the challenge vaccine trial is hypothetical, but John Gentle, A.B. Rohrig, and 16,000 others say they are ready, if needed, to take the risk if it means they can be part of ending the COVID-19 pandemic. Drew Griffin, CNN, Atlanta.